Good evening, and thank you for coming. My name is Bill Jones. I'm co-chair of the Dukes County Youth Task Force, which is a subcommittee of the Dukes County Health Council. And we are fortunate to be well funded by our grant money to have two excellent coordinators who pull our speaker series together. This is our third speaker series that we've done. And each year we seem to draw stronger and stronger speakers to come here to talk to the Vineyard, and we're very excited about having Dr. Traci Brooks here to speak to us tonight. For those of you who don't know about the Youth Task Force, we are an organization of about 50, a coalition of about 50 people representing all of the organizations on the island that work with youth. We have great cooperation from all of the schools and from Superintendent Dr. Weiss that isn't experienced by a lot of the schools or a lot of the other coalitions that are working with schools. So in a typical Vineyard fashion, people have really come together to make the Youth Task Force a very powerful organization, and it allows us to create evenings like tonight. Out in the lobby, we have some brochures that list the rest of the speakers for our speaker series for this year, and we would encourage you to pick one of those up when you leave. But first and foremost, I'd like to introduce Dr. Traci Brooks. She's a graduate of the University of Virginia and Johns Hopkins Medical School. She specializes in pediatric adolescent medicine at Cambridge Health Alliance. She has a husband who's a pretty good golfer and getting better all the time. We got the chance to play with him today. It was a lot of fun. And she is the director of adolescent medicine services. She's also the medical director of the Teen Health Center in Cambridge, Somerville, and Everett. And she spoke to the high school students and some of the staff this morning, and we heard those went very, very well, and we are very excited to hear what she has to teach us tonight. So thank you all for coming, and Dr. Brooks.
Thanks for that great introduction. I'm a little short, so I hope if I rotate this downward, it's not going to do anything to hurt the microphones. And sounds good. We're not getting any feedback, so I'll take that as a good sign. But thank you for the wonderful introduction. Of all of the things that Bill mentioned, yes, I do all of those things, but first and foremost, I am a pediatrician. I take care of patients. That's my favorite thing to do every single day. And I do a whole lot of work individually with patients and families around various high-risk adolescent issues. So I like to be able to come out into the community and do some educational work as well around how to work with your own teenager at home. So as you can see, the title of my talk is The Teen Brain, or Help, My Child Has Been Abducted by Aliens. And to further illustrate that point, everybody remembers those kids. Those were the ones that were really helpful. They responded well when you talked to them. They helped you out around the house. They were friendly towards their siblings. They got a little older and they turned into those kids most of the time, friendly towards others, still helpful around the house and civil towards you and having a good time with their friends. But sometimes you get them where they don't want to hear what you have to say. They want to scream and talk back. They feel insecure about themselves, and occasionally it can progress to them where they are sort of retreating into themselves with various adolescent issues that they might run across. So who is this person? The adolescent's main job is to determine their own sense of self, and that's what their brain is going to help them be able to do, is progress through their sense of self from turning from a child into a young adult. So questions that their body and brain have to answer are, who am I, which goes along with having identity development. Where do I belong? And in that classification, we'd have self-esteem as well as getting along with peers. And how do I relate to other people, which can often result in the formation of cliques, and the cool kids and the in-and-out kids. So to talk about the brain to start, the brain has two different growth spurts that occur over the course of life. First, our brain grows before we're even born. It's in the womb and during the first several months after we're born. But most of the changes occur sometime between 3 and 6 months gestation or during the second trimester. The second growth spurt, which is what we're going to talk about in more detail today, is at the onset of puberty. And at that time, we get changes in the number of synapses. And what a synapse is, I'll show you into more detail with some drawings, but what a synapse is where the neurons of the brain connect to each other to be able to spread information through the brain. So we create fewer of those connections, we prune away all of the stuff that we don't need, but they become faster and much more efficient, so the ones that we have work better. It used to be thought that our brain, by the time we were 3 years old, our brain was our brain, and that was it. There were no further changes that occurred either in the growth or the development of the brain. And we now know for sure that that's not true. By the time we're 6 years old, our brain is about 95% of the size it's going to be when we're an adult, but it's still remodeling a great deal. This slide shows what happens with the cortical maturation from age 5 to age 20. Now, the cerebral cortex is kind of the thinking and functioning part of the brain. And again, coming up, we'll talk about that some more. But what you can see from the left-hand side with the 5-year-old brain, it's got a lot of pink and red, and the pink and red are the much more immature areas. And as the brain continues to progress to the 20-year-old side, you'll see that there's a whole lot more blue. The areas that develop in our brain first are things that we really need. So speech centers, movement centers, and other functioning executive functions of our brain. But then as we progress through to age 20, the abstract thinking and the ability to problem solve comes much later. And in fact, you'll notice in the 20-year-old brain, there's still some green hanging around. If I can get the pointer to work. There's still some green in these sections, and those are the sections of where we process judgment and create judgmental decisions, and those are still not finished by age 20. They're actually not done until about age 25. I think of everybody in terms of age restrictions that we have in the United States, the rental car companies are the ones that got it right. You can't really rent a car until you're about 25 years old, and that's because they want to be able to get their product back at the end of the car rental. But it's true, just because of impulsivity. They were having a lot of problems with the age being 21 of wrecks and not getting their cars back. 21 is the age limit for alcohol drinking, and it's 18 for cigarette smoking and joining the military, because you actually, for military purposes, you do kind of want people who are going to have more impulsivity. So what happens? Well, the gray matter, which are the thinking parts of the brain, first get really thick and then it thins out. So you can see all the way to the left, that's what our neurons look like when we're first born. They're there, you can see that there's tiny little cell bodies that are there, but the dendrites, or the branches, the connections between the cells, really don't exist. As we get up to age 6, they become very, very, very thick, because your brain's growing, it's experiencing all kinds of things, and those branches grow really fast. As we progress through puberty, the brain says, okay, there's a whole bunch of stuff here that I don't need, and I'm going to prune that away so that I can keep the parts of the brain that I am using to be much more efficient. So this is what we call sort of the use it or lose it. And again, an illustrative example that I use with that, if you have Andre Agassi and Steffi Graf are married. So their kids are going to be predisposed to being really, really, really good tennis players. So they have the genetic material to be able to be excellent tennis players. But if they don't practice and learn how to play, their brain is going to prune away that material because they're not using it. They're not using that portion of their brain that's teaching them to be able to play tennis. As the brain becomes more efficient, it does become less able to recover from trauma. I went to med school at Johns Hopkins, and a pediatric neurosurgeon there named Dr. Ben Carson, pioneered a surgery that was called a hemispherectomy. And in that, he actually can remove half of a child's brain for children that have either sustained significant head trauma or kids that are having problems with chronic seizures and other activity. They can remove the parts of the brain that are causing the problem. Well, interestingly, they discovered if they removed the half of the brain before age 10, the other half of the brain could take over the entire functioning of the entire brain, almost as though the child had never had any portion of the brain removed at all. Versus if they waited till after the age of 12, it became very difficult for kids to relearn those brain pathways for the parts of the brain that had been taken out. So if they had taken out the pieces of the brain that had to do with motor skills or with depth perception or with vision. After the age of 12, the brain couldn't take over and resume those tasks, and people continue to have deficits. Something that I've noticed practically associated with that, with working with kids in the office and parents and families in the office, is in Cambridge and Somerville and Everett, we do get a whole lot of immigrant families who come to the United States. And I will see them when they first arrive. No one in the family speaks any English because they've just gotten there. And if, say, there is an 8-year-old, maybe a 14-year-old, and then the parents, I'll say to the 8-year-old and the 14-year-old, you guys are going to be speaking perfect English by the time I see you next year. And inevitably, everybody looks at me and they go, yeah, okay, whatever. Sure enough, next year rolls around, 9-year-old comes back for their annual physical, speaking perfect English, as though Massachusetts perfect English anyway, with accents and everything else, perfectly, with pa, ka, like they'd been in Boston their entire lives. 14-year-old, a little bit more trouble with English, a lot of times with tenses and things like that, and other grammatical aspects. And also they continue to have the same accent as from their home country. They don't lose that as easily as a younger child would when they're learning the new language. And the parents often are needing to use the 8 and the 14-year-old to be able to interpret for them because they haven't learned, have had significant difficulty learning English. So that's sort of a practical life visualization and life example of this brain plasticity phenomenon. So let's talk about the frontal cortex. The frontal cortex is what's responsible for planning and strategizing and problem solving. So I call it the CEO of the brain. Part of the reason that teens participate in incredibly risky behaviors is because the judgment center develops last, and their remainder of their frontal cortex is incredibly immature. Also during the teenage brain development, we will see this a little bit later, but rapid changes in areas of the brain that have a whole lot of dopamine receptors and dopamine neurotransmitter, which is what are the pleasure centers of the brain, because that grows really quickly and that grows first before the judgment center kicks in, makes teens much more vulnerable to drug and alcohol addiction because they want to please those pleasure centers but don't yet have the judgment to think, hey, maybe I shouldn't be doing this. So because they're also more likely then to participate in risky behaviors and experiment during this time, it's a primer basically to feed into drug and alcohol addiction. So where in our frontal cortex do we think? I don't even think that there's any kids in the room. This worked really nicely when we had the assembly today. But how do you as adults view this picture? What emotion is this person conveying? Anybody? Fear. I heard fear all around, which is how adults will see this picture. And we had the kids in here this afternoon, and I was hearing shock, and I heard a couple of angers, so it actually works. Sometimes I'm always worried that they're not going to yell out the right words, but it really does work. At McLean Hospital in Belmont, they used a scanner called a functional MRI scanner. Everybody knows what a regular MRI scanner is. It takes photos of the body using a magnet instead of using radiation. But at McLean, they have this functional MRI scanner where people sit in the MRI scanner and they can show them different pictures, and it actually shows what parts of the brain they're using to be able to process things. So it's pretty cool. And they used this functional MRI scanner and showed pictures to kids, teenagers, and adults. And most adults do register this as being a picture of a person expressing fear. But many teenagers and younger children will see this as being anger or shock because teenagers actually use a different part of their brain to read the picture. The study showed that the teen brain used to see the picture used this part of their brain. And this is called the amygdala, and that's in the limbic system, which is the emotional part of the brain. They had a tiny little section here in the frontal lobe, right there. Pointer doesn't want to work for me very well. But adults mostly saw the picture in the front, or rather processed the picture with their frontal lobe, again, the rational thinking section of the brain, with much less in their emotional center of the brain. So the teen brain mostly measures in the emotional center in the amygdala, and the adult brain mostly measures that picture and reaction to the emotions of the picture in their frontal cortex, which is the rational thinking part of the brain. So again, as I said, they use these functional MRIs to determine the response to pictures of the faces, and this finding then suggests that perhaps teenagers can't always accurately read adult emotions. And if anybody has a teenager at home that you've gotten into an argument with, you've probably been kind of surprised at the emotional response that you might get back when you're fighting with them. And shocked that they can't sit down and discuss something with you in a rational way. Because teen behaviors may not always be the correct adult response to adult behaviors, because they have more emotional than a rational response. Now, ironically, and I'm sure everybody has heard this, your teenager probably thinks that he or she is the one that is being misunderstood, when it's actually you as the parent. Now let's switch gears and talk about the cerebellum. The cerebellum is the highlighted red section that's in the posterior part of the brain, and it sits right above the spinal column. It also changes a whole lot, in fact, the most during the teen years, again, all the way up through the early 20s. And what the cerebellum is, the frontal cortex is the CEO of the brain. The cerebellum is the COO, it's the chief operating officer of the brain, because it's responsible for your body and brain coordination. It's responsible for muscle coordination, as well as thinking coordination. It kind of makes everything work together. As teens are growing, they're growing really quickly. They get long arms, long legs, big feet, pretty uncoordinated with trying to manage their body. Well, it's the same thing with their cerebellum trying to manage their brain. So they could have some physical clumsiness in addition to having mental clumsiness. Now, some studies that are actively being done have shown that perhaps kids being more sedentary than ever before may contribute to underdevelopment of the cerebellum, leading to chronic mental clumsiness because they're not moving around and using their bodies. Perhaps this is also related to their cerebellum not developing completely, and they will also continue to be more mentally clumsy as well. Teenagers and sleep. Teenagers, in reality, need about 9 or more hours of sleep per night because their brain needs this downtime to be able to effectively reorganize and undergo these efficiency and pruning stages. The reality is that they get probably 7.5, or honestly, polling the audience today, it was really about 6.5 hours of sleep per night on school nights. That results in large sleep debt. They try to make it up on the weekends, sleeping till noon or 1 or 2 or later, but your brain's not a battery. You can't store up sleep for future, or a bank. You can't store up sleep to be able to remove it later. Now, what's really interesting is a cruel twist of irony that goes along with this is that you'll have a teenager who goes to bed at midnight, wakes up at 6:30 in the morning to be able to get to school, makes it through the school day feeling completely exhausted, gets home. If they manage to not take a nap, they'll still be much more wide awake again at 9. And it's because with the changes in the brain, the pineal gland is responsible for sleep. That's also helping, that's also growing and changing during adolescence. And it, instead of releasing melatonin appropriately, will not release enough melatonin, and they'll be wide awake when they should be getting ready to fall asleep. And so their brain is almost forcing them to stay awake, and the cycle then starts again the next night. Some sleep solutions that have been discussed and used around the country include a pilot program that they did in Minneapolis, where they had the high school start an hour later. So school started at 9 o'clock and ended at 4 o'clock in the afternoon. What was great is that kids were much more alert. They were more likely to come to class. They had better class participation, and everybody got better grades. The problem is because school was getting out so late, people didn't have time to participate in extracurricular activities or do after-school jobs or any other things that teenagers will routinely participate in after school. So it's important for individual communities, I think, to decide what's important. My sister lives in South Florida, and her cousin-in-law is an administrator in the school system down there, and they're actually currently trying this with school starting at 9 o'clock and ending later in the day. And when I was visiting recently, she reported that actually it's been going pretty well, but people don't have time to participate in their after-school jobs, so the kids, even though they're excited about going to school a little bit later in the day, are also somewhat upset about the crunch on time. Oh, actually, one further thing about sleep that I neglected to mention in the previous sleep side. Cell phones and sleep. Or I should say cell phones and lack of sleep. Everybody seems to be connected to their cell phone essentially 24/7. And for kids, it's no different. They're constantly texting. They're constantly waiting for texts back from their friends. If kids have their cell phone in the room with them when they're trying to sleep, their subconscious brain, even if they are sleeping, their subconscious brain is still listening for that ping of a text. And they're never actually able to fully get into decent amounts of REM sleep. So even when I have kids that come into the office, I slept 8 hours last night and I'm still exhausted. I inevitably will ask, do you sleep with your phone in your room? The answer is always yes. Kids really need to get the phones out of their room. If their brain knows that it's disconnected from the phone, if it knows that there's nothing to be able to listen to, they will actually cycle through sleep stages much better. So now we're going to break it down and kind of microscopically look at the brain. This is a close-up of the axons and dendrites. Again, the axons are the neurons or the cell body, and the round part is the axon, and to communicate with another cell, it extends out a dendrite. So that's what's growing, forming, and being pruned all through adolescence. So that's the synapse right there. That's the connection. The synapse is called the connection. The connection between the axon and the dendrite is called the synapse. So here's a synapse up close. And what the synapse's job is to release whatever neurotransmitter is important for that particular part of the brain. And there's many, many, many different neurotransmitters that are utilized in our brain. It's released from the end of one neuron and picked up by these little receptors on the end of the other neuron. So what? So who cares? Why is that important? Well, again, let's get back to our brain. I'm just showing the refresher side of what happens during the changing and development of the brain. Here's how marijuana, as an example, and other chemicals that we use, alcohol, tobacco, or nicotine, everything else, also have similar shapes to various neurotransmitters that are in our brain. So THC, which is the active ingredient in anandamide, looks remarkably like THC, which is the active ingredient in marijuana, looks remarkably like this one called anandamide, which is one of the neurotransmitters that's actually responsible for helping our brains prune and become more efficient. So if you have a teenager who is smoking a lot of marijuana and the receptors are taking up the THC instead of the anandamide, they actually may be inhibiting the appropriate development of their brain. And you could say the same thing about various other chemicals, including alcohol or nicotine. Other reasons that this is important, again, our brain's still forming and growing. One other thing that has to happen in the brain to help us be able to clear these various chemicals is we grow receptors specifically for those chemicals to help bind to them and inactivate them. So using substances while your brain is growing and forming could also, again, using marijuana as an example, if a teenager is smoking a lot of marijuana, they're also going to form more cannabis receptors on their brain because their brain thinks that having cannabis around is normal and is going to have to clear it. These receptors are constantly crying out to be filled. So if a teenager is not smoking and they're empty, these receptors are literally screaming at them, going, fill me, fill me, fill me, because they're there. Now, if somebody has been smoking a lot and then they stop, it is possible to sort of down-regulate the number of receptors that are there, but it's a very difficult process. And that's part of the reason, again, that teenagers are much more likely than adults to become addicted to substances because their brain has formed with these substances on board, so therefore their brain perceives having the substances on board as being normal. It becomes much more difficult to quit using. So reward pathway in the brain. Now I've chopped our brain in half and we're going to look inside of it instead of just at the outside. And the reward circuit runs through the center of the brain and it starts in that area called the VTA, which stands for the ventral tegmental acumen, and then moves to the nucleus accumbens and around to the prefrontal cortex. And there's dopamine-rich receptors all through that whole area. And when they fire in the direction of the arrow, that's when we are experiencing something that feels really good. That's how our brain feels good. So you expect to get a reward, and it starts the circuit, which starts at the VTA and shoots around. So activation of the reward pathway by different addictive drugs, those dopamine receptors also really like heroin, marijuana, cocaine, nicotine and heroin, and alcohol, all have receptors along that individual reward pathway because they all will stimulate release of the dopamine when they attach to the neurons. So there's natural rewards that elevate dopamine levels too. Food, particularly chocolate. If you eat chocolate, you get a really nice rush of dopamine that shoots through your brain. Sex, same thing. Being sexually active and having sexual stimulation, you get a really nice rush of dopamine that progresses through your brain. Marijuana is not that different. Not quite as dramatic as the other. You can see that the slope is a little more gradual, but it still does produce a pretty decent sized dopamine release that then falls off through the brain. Well, back to our functional MRI scanner, they did a study where they took children ages 7 to 11, as well as teenagers 13 to 17, and adults ages 23 to 29. Now, for whatever reason, it came out black on the slides of the teenagers, but white. It's a white line, but really it's the black line that sort of runs underneath. And what they did was they put people back in the MRI scanner again, and they had them get either a small reward or a large reward. Now, the small reward was they played a game of memory in the functional MRI scanner. You know, the game of memory where you have to match one card to the other card, and if you win, all you get is the cards. Well, the little kids thought that was great. Look at the blue line. Look how much that spikes up. That's why little kids love playing that game. The adults, not so much. You can see that they really didn't have any significant reactions one way or another playing the game. What's interesting about the teenagers is they anticipated that they might be getting a reward by playing the game, but when they found out it was only that they got two cards that were matched together, it actually sucked dopamine away from them, which is incredible. So, you know, when your teenager tells you, wow, that's really lame, it's because their brain actually is telling them this is something that is really, really, really stupid, because it sucks the dopamine away when they don't get enough of a reward. Now, conversely, they played the same game with the same folks, and this time when you matched the two cards together in the memory game, you instantly got $100. So that became a much larger reward. The little kids' slope seems about the same. Little kids don't perceive money, I don't think, in the same way adults and bigger kids do. The adults got a little bit more interested, but look at the teenagers' spike completely in the opposite direction with getting a large reward. Again, small reward sucked dopamine away, large reward created ginormous surge of dopamine. So getting back to what we were saying before, the prefrontal cortex, again, the brakes, develops much more slowly. You see that it's completed all the way out there on the right with the blue arrow, adult age 25. But the nucleus accumbens, which is part of that reward pathway, is much earlier and really starts growing and finishing up somewhere around age 13 to 15 in adolescence. Therefore, teen brains have a higher risk for addiction than adults when they're exposed to highly rewarding stimuli. Again, instead of the $100, substitute the effects of alcohol and drugs. Because of this greater reward sensitivity, incomplete networking of the brain, because the frontal cortex isn't done, and faster learning with this neuroplasticity and pruning the brain. Sobering slides that show the risk of alcoholism, age of first drink. Folks who start drinking at age 13 or less, because of all of these factors that I talked about, actually have a 47% chance of becoming alcoholics when they're older, versus folks who start at the age of 21 have a 9% chance. You have a 5 times as high likelihood of becoming an alcoholic if you start drinking at age 13 or under. Same with marijuana abuse or dependence. Numbers are a little bit lower, but the ratios are about the same. If you start smoking marijuana at 13, you have a 17% chance of becoming dependent on marijuana versus beginning to smoke at age 21 plus. So marijuana is especially addictive for teens. More 15 to 17-year-olds are actually in treatment for a primary diagnosis of marijuana dependence, only marijuana dependence, no alcohol, no other drugs, not even with nicotine, but then for all other illegal drugs combined. Now the next slide actually shows the number of people that are 12 years and older receiving drug abuse treatment in the year 2009. Marijuana is way out in front. This is in the thousands. So 1,243,000 people were receiving treatment for marijuana in the United States during that time frame. Higher than all other illegal drugs. You'll notice that all the numbers on the left, of course, don't add up to the 1,243,000 because there are some legal, quote-unquote legal drugs there, including pain meds and tranquilizers like benzodiazepines, as well as stimulants like Adderall. But marijuana is still way out in front when you compare it to all other drugs for which people are receiving treatment in the United States. So again, looking at where this affects our brain, the purple are concentrated receptors. This, again, specifically is for THC, but you could substitute any other substance as well. Heroin, alcohol, nicotine, all will be along these same pathways because they mimic different neurotransmitters. You can see in the reward pathway, the whole reward pathway is purple because it's so lined with the receptors. But then they're in different parts of the brain too. This area is called the hippocampus around here, and that's responsible for memory formation. This section here is the cerebellum, as we learned before, and that's our balance and coordination system. And then our frontal cortex is all up through here through this, for different areas of the brain. And then judgment is right there. So what does marijuana do? Well, it goes from your lungs, gets into your bloodstream, and travels to your brain. The THC binds to the receptors, as I showed in the previous slide, in different parts of the brain. So the hippocampus, again, that's that C section, backward C that goes around the reward pathway there, affects memory and conversation. The cerebellum, which we all know is at the back of the brain, affects distance as well, and distance perception, as well as movement coordination. And then the cerebral cortex, the whole top part of the brain, affects your whole brain coordination, attention, vision, and time sense. So these are, again, an illustration of the different parts of the brain that are affected by THC. And specifically looking, the green is where movement is controlled, red is body sensations, the top part of the cerebral cortex in the back is vision, cerebellum is coordination in orange, memory is yellow, reward pathway in purple, and judgment in blue. So what's marijuana do to your teen brain? Well, it might decrease the thickness of the gray matter in the frontal cortex by either increasing or decreasing the pruning, depending on which neurotransmitters are involved. It increases numbers of the cannabinoid receptors in the brain. That makes addiction and dependence more likely. It might decrease blood flow to the cerebellum. That leads to lasting coordination issues because it can't form and develop properly. It might lead to chronic attention deficit, impulsivity, and inability to learn from any previous mistakes. Alters frontal lobe activation seen on functional MRI, and overall is just much more vulnerable to drug use because of the maladaptive plasticity of the brain. Now, this is a digression slide that I have, because one thing that I get from parents not infrequently, and I guess we'll have some time for discussion so we can certainly talk about different things, is that they don't want to seem hypocritical towards their teens. If they think, I was smoking marijuana back in the 60s and 70s, and I don't want to tell my kid that they can't do it for today. Well, the reality is marijuana is becoming a way, way, way more potent substance than it ever was. The University of Mississippi actually has a contract with the DEA to analyze the THC content of all seized marijuana. And they do that annually and put out what the percentage of THC is in seized marijuana plants across the United States. When they first started doing it, it was 1994, and you can see that it's a little bit less than 4%. If you wanted to backtrack and look at numbers from the 60s, 70s, and early 80s, it really hovers somewhere around 2%. But since that time, because marijuana, again, is such a productive crop, people are trying to get the most bang for their buck out of their product, and it's becoming much more highly concentrated in THC. The average in the United States now is about 9% for what's seized by the DEA. But if you look at different regions in the country, particularly Northern California, you can get marijuana plants with THC percentages up to 20%. Which just is astronomical. So you have to remember that these numbers are averages. And what happens with higher doses of THC is not only that people are getting intoxicated and high from marijuana much more quickly and at much more rapid rates than they were with the lower amounts, but it's also much more likely to develop some physical dependence issues associated with that, again, because of the very high THC content. A lot of the kids today were saying, no one's died from marijuana overdose. And that's true, but you can sure get a whole lot of bad symptoms. In particular, the anxiety and paranoia seem to start at much lower amounts used, as well as jitteriness and just inability to sleep with either using or trying to come off of using marijuana. So there certainly are not insignificant side effects that go along with smoking nowadays. And we can, again, talk about that in some more detail when we have the lights come back up. This is one of my very favorite cartoons that I have for parents. Kids leaving his parents, bye, I love you. The parents say, what did you say? Kid says, I said, I love you. Let me see your eyes. I don't smell anything on his breath. says to his friends, "Sorry I'm late. I was thoughtful to my parents, so they made me take a urine test." Thanks for your attention. I think we have plenty of time for questions. And lights.
So what does it do to the brain if the child is exposed to dextroamphetamine for ADHD for years on end?
Very, very, very good question. And you could say the same with SSRIs, with so Prozac and Zoloft and other medications. And that, do we downregulate the functioning of those particular receptors? And I think that this is something that is ongoing. The main difference, though, associated with using ADHD is that kids that are suffering from that tend to have low levels of the dopamine or I shouldn't say low levels, but lower levels of some of the neurotransmitters that are involved in helping us to be able to focus. And so what the Adderall and Ritalin do is they help those neurotransmitters be produced in higher amounts. Are we actually doing people a disservice? Part of it, it's really hard to tell, because if you have anybody take a stimulant, even if you're somebody that doesn't have ADHD, you're going to have incredibly good focus, because anybody is going to have those neurotransmitters released. But that's part of the reason that I always recommend that kids have drug holidays from taking their medications. If they can avoid taking them on the weekends, that's great. If they can avoid taking them in the summer, then that's fantastic, because there's other side effects that go along with them too, including lack of appetite and growth stunting and some other things. But I do think that they do have some more significant effects on the brain than we realize.
But does the brain then become accustomed to having that receptor filled and expect it to have it filled for life? And does the child become less functional? Does the child who becomes an adult become less functional without that receptor?
Well, what's really interesting is a lot of people actually do grow out of ADHD. A lot of people don't. Many adults self-medicate with coffee and cigarettes. I give my husband a hard time all the time, because not with cigarettes, but he drinks probably about 8 cups of coffee a day. And I tell him that he's probably self-treating some version of ADD that he might have going on. But in reality, yes, I think that there's a possibility that we could be keeping people from upregulating. A lot of folks, though, will grow their own receptors and not necessarily need the meds. The other question, though, is it that adults with ADD tend to choose jobs and careers that they don't need to be sitting in one place all day and needing to function by focusing on something. So do people self-select out to be able to manage that? Yes? Oops.
In your chart about kids and people being treated for drug dependence or addiction, Adderall was one of the bars.
Stimulants was one of the bars, yes.
So can you expand on that a little bit about?
Well, as I had said, anybody who takes stimulants are very interesting, because anybody who utilizes a stimulant, you're going to be more awake, you're going to be more alert, and you're going to be able to focus better. That's the case for anyone, whether or not you have attention deficit. People who have attention deficit helps them be able to move into the realm of functioning. People who don't have attention deficit sort of pushes them past that into the realm of just being awake. I think part of what happens is a lot of kids who are on stimulants discover very quickly that their peers would like to be on these stimulant medications, not only in part because it will help them be able to focus and do a better job, which is what we see often in college students, but with this sleep debt that everybody's getting, it's going to help them be able to be more awake and get through the school day without getting in trouble for falling asleep during class. And if you have folks that are taking them sort of outside of prescribed recommendations, so instead of somebody's taking not just one Adderall in the morning, but needing to get through their whole day by taking 3 or 4, you can certainly foster a quicker dependence that way too. In the back. The question was sort of talking about moodiness and the angry side of teenage boys. Did you have something specific that you were wondering about, or? There is. It goes along with, again, not full development of the frontal cortex to be able to help them understand why they're having the feelings, but the strong emotional responses. A lot of boys, especially if they are having depression issues, will have anger and moodiness versus girls are sad and weepy. But they end up expressing their emotions with strong outbursts of anger, because they're emotional. Remember, the amygdala was growing most rapidly. That's growing very, very quickly, and they can't sort of rationalize it away. So they might lash out of anger much more quickly because they can't tamp it down. So it's the same thing, not only just seeking reward pathways, but also just having difficulty managing emotions. And boys just tend to express it much more with irritability and anger. And does that have to do with testosterone's function on the brain? Probably. Versus girls and estrogen function on the brain causing more likelihood to develop sort of just sadness and feeling visibly depressed. It can. I would say, especially for that, it really is going to stretch out to probably more about 25 than the 21, just because of the judgment areas of the brain being developed last. But for some folks, and again, there's no set pattern. Everybody's brain doesn't exactly develop in the same fashion. So you're going to have some folks that either are stuck with that their frontal cortex doesn't develop enough to be able to overcome the rapid growth that they had in their amygdala center. And so they may be more predisposed for life to just be much more irritable and angry. But what often goes along with that is the substance use. And the question is, if youth are then using they're using substances, are they actually then inhibiting the development of their cerebral cortex just as because they're using the substances, and then they're sort of stuck more in adolescent brain mode? In the middle, in the green.
Yeah, would caffeine be similar to like THC and the other drugs, with just the body, the brain respond by becoming addicted that way too?
Yep.
Same way. What about if you're going to develop something like aspartame?
Aspartame, I'm not sure of. And aspartame, for everybody who doesn't know, it's the chemical that's in NutraSweet, so artificial sweeteners. And I'm not sure of any studies that anybody in particular has done on that. I'm sure they probably exist. I don't know all of them, so I don't know what that is. But what they might be doing around that. But caffeine, for sure, you're going to upregulate the receptors the same way as you would with any other chemical substance. It's going to be there, and that's why so many people, you have to have your morning coffee. You're physically addicted to your morning coffee. If you're in withdrawal from caffeine, you can get headaches, moodiness, crankiness, fatigue, because those receptors aren't being filled. Yes.
You talk about changing the receptors in the children that are used to getting certain highs, and you said it's very difficult because if the receptor really is always there, does it shrink?
They do what we call down-regulate. And as the brain sort of keeps repruning itself, you still get more and more pruning as we go through life. We're not, our brains aren't repruned at 14 and then they're done. Our brains are constantly reshaping, and adults can learn new things. So I don't want to discourage anybody here from thinking that they can't learn a new language or learn any new skills, because that's certainly not the case. So your brain does continue to reshape, just not at those rapid rates. But if it's not seeing those receptors, again, use it or lose it. You're actually not using those receptors, so the brain is going to start to prune them away, just not as rapidly as they were able to grow. Yes?
Getting back to pod, could you talk a little bit about how using it might affect the formation of myelin?
Very good question. Using marijuana, myelin, gosh, tongue's getting all tangled up. Myelin is white matter. So that, when I was talking about how the neurons become more efficient, that's how they become more efficient. They get coated in this stuff called myelin, which helps the neuron be able to process thoughts much more quickly. It literally acts like nonstick. And so the neuronal activity can move much more rapidly from one cell to the next once it gets coated in this myelin. Now, part of the reason I didn't bring it up in my talk is because there's actually conflicting studies about myelin and marijuana. But since you brought it up, we can discuss them. There's one study that's been done that actually showed that marijuana contributed to much rapidly increased myelination of the brain. What's interesting is they've linked that up with schizophrenia, because one of the associations with schizophrenia is increased myelinization of the brain. And there's a study that's there that showed that people who smoke marijuana have about a 7 times highest likelihood of developing schizophrenia as people who do not. It's one study, but it's definitely there. And similarly, people who smoke marijuana who have a first-degree relative that has schizophrenia, so they're already genetically predisposed to getting schizophrenia, are going to be much more likely to develop schizophrenia because of the increased myelinization of the brain with marijuana smoking. Now, some people will say, oh, well, wow, what's wrong with that? That makes your brain much more efficient. Unfortunately, it's going to prune, it also, myelinization is associated with pruning away more parts of the brain. So you end up maybe with some more efficient pathways that are left over, but then you have decreased pruning. And there's another study, though, that's been done that showed that actually chronic marijuana smokers had more gray matter than white matter. So the jury's still really out on this. I do think that the schizophrenia data is very interesting, but that's something that continues to be a work in progress. Yes?
I'm calling it a perception gap that you described with the McLean study, the difference between adult and adolescent perception of, it was the facial characteristics, but it's conversations every day in terms of perception. I'm just curious about recommendations for managing, because it's, Mars and Venus type of thing doesn't really necessarily find you a middle ground. And if they think you're wrong and they're right and vice versa, I mean, what's your...
It's, once the cat's out of the bag, it's very hard to sort of be able to rein things back in. So oftentimes, what can be very, very helpful is for you as the adult to not get sucked in to the emotionality of the kid. And I know that that's really, really, really hard, but that is the key, is to not allow yourself to get sucked into their tornado of emotionality and start yelling back, because that's when problems start. So if you can continue to actually steel yourself to continue to speak in a calm, rational voice, sitting down actually can also be very, very helpful, and particularly sitting alongside your child or young person instead of like standing in their face, which is going to just sort of spark reactivity with them, can be helpful. A lot of kids will tell me that they like to hear and have difficult conversations with their parents sitting in the car. Because parents like it to have kids sitting in the car because they're not easily going to be able to escape and run out from whatever it is that you're trying to talk to them about. And the kids like it because you're not directly staring at them. They feel much less judged and they feel much less scrutinized. And it's a lot easier to talk about difficult topics that way when you're side by side than sort of head on with each other. So that's certainly a very good recommendation that I often suggest, and kids will say it too. And kids might actually be more likely to bring up difficult topics with you when they're sitting in the car with you. So I think that that's a good time. Having dinner, again, if hopefully dinner for many people is a de-stress activity. I know it can be hard in this day and age when we're all really stressed out and doing all kinds of things, but they've actually shown, again, that parents who have dinner with their kids at least 3 days a week, and I say dinner, you could make it breakfast, you could make it whichever meal you want. The key takeaway is to have a meal with your kids at least 3, if not 5 times per week, so that you can sort of be able to be there with them. Those kids are about 3 times less likely to participate in high-risk behaviors when they feel like you're checking tabs on them and sort of just checking in with them about how their day went. So that's another really good way of keeping things from getting away from you as a parent. But really, getting back to your original question, just don't get sucked into the drama. Yes?
I like what you said about the cell phone, about getting the cell phone out.
Yeah.
But what if I'm just curious about what I'm gonna do with my own son, because he's still I think he turns it off to charge it.
Mm-hmm.
So it's really, he's not waiting for that click of the text, because it's charging.
Is it off?
I'm curious about the way I'm gonna kind of go, well, we're just gonna, what if I have my cell phone in my own room?
Somebody had a very good suggestion today. When I was meeting and talking with the teachers, they said that what they've started doing in their own home, which I thought was great, is at the end of the day, everybody puts their cell phones in the kitchen, parents included, and they all charge in the kitchen. No one has their cell phone in their room. The parents are leading by example of not having their phone with them either, and sort of making that disconnection. Another reason of getting away from small screens at nighttime, actually, so not just cell phones, but iPads and TVs. Everybody's got HD TVs now, which just emit, even though they're supposedly low light emitting, it's actually much more concentrated light. And what happens is, if you're in the dark in your room looking at a movie on your iPad in bed or staring at your cell phone or whatever, it's actually going to stimulate your pineal gland, and you're not going to make enough melatonin, and that's going to be part of what helps keep people up at night. So one thing that's not a bad ritual to develop in a household is, 9 o'clock, 2 hours before bedtime or whatever, everybody just sort of disconnects their cell phone or their iPad or whatever other electronica that they might have, and no one keeps it in the room with them. But even if your son is charging his phone in his room, it's still on, so if he has not physically turned it off. And also, it just seems to be the presence of the phone. It's very interesting. If you remove the presence of the phone, the brain just sort of goes through different cycling. It's literally that subconscious feeling of not having it there with you.
I thank you for that. I'm taking that home with me. I'm gonna do it.
Good, I'm glad someone got one out of it. Yes, honey. Oh, sorry, thank you.
Doctor, I was curious, is it now common practice for pediatricians to screen for drug and alcohol use?
Ah, thank you. I feel like I should have called on you earlier. You're like my plant in the audience. Yes, that's what we're trying to do. And as I work with a bunch of folks at Children's who have developed something called the craft. And are you waving to ask about that similarly? Oh, I'm sorry. He was asking if pediatricians are making it common practice to screen for drug and alcohol use. And because we are pediatricians are strapped for time. We see large numbers of kids in very high volume. There's just not a whole lot of time there. So the folks at Children's needed to create a really short screening tool that we actually suggest to all pediatricians to use in the office to help pick up kids that may have substance use problems. And it's an acronym that is called the CRAFT. It's CRAFFT. The C stands for, have you ever ridden in a car with anybody who is driving alcohol or drugs under the influence? The R stands for, do you ever use alcohol or drugs to be able to relax or fit in with other people? Again, that's your most common positive answer you're going to get from teenagers because they're very social with their substance use. It's a social activity. It's what they do at parties and when they're around their friends. The A stands for, do you ever use alcohol or drugs while you're by yourself or you're all alone? Can get at dependence use problems. Again, I just said that substance use for kids is social, so if they're using when they're alone, could have a substantial dependence component there. The first F stands for, do you ever forget anything that you did when you were using alcohol or drugs? Gets at binge drinking behavior or other blackout type activity. The second F is, do your family or friends ever tell you to cut down on how much you're using? Quick aside, I was watching this interview, or something I was listening to on the radio, and they were interviewing Keith Richards, and he was telling Amy Winehouse that she needed to slow down. And I'm thinking to myself, if Keith Richards is telling you you have to slow down, you have a serious problem. But that illustrates the second F with family and friends telling you to cut down. And then T stands for trouble. Did you ever get into trouble because of your alcohol or drug use? Now, trouble could mean your parents found out and you got grounded, or it could mean that you did something you otherwise might not have done. You got in a fight with somebody, you had sex with someone, you did some other behavior that wasn't your normal behavior. So that 6-item screen is actually really quick. If people don't even have time to ask it in the office, you can give the kid a piece of paper with the questions on them. Is what we've been encouraging folks to do as pediatricians, so they can do check boxes. And then you get the results back. If you have a kid that has 0 positive answers, they are still considered at low risk. There is no teenager on the face of the planet who is at no risk for substance use. So 0 positive answers still means a low risk teenager. 1 positive answer is a kid at 1 to 2, is a kid at moderate risk for substance use issues, and 3 or more positive answers on that screen is a kid that's at high risk. Now, I always tell parents and adults, don't do the craft on yourself. People get to that alone question, they're like, oh man, I was watching the Sox last night and had that beer. What does this mean? Nothing. It means nothing, because substance use for adults is just, it's different than with kids. So you can't apply, these are not normed for adults, you cannot apply them to other adults for the most part. Then what we do is, once we have the results back of the craft, you can give either sort of a brief intervention, what we call brief intervention. And that might consist of, if a kid has 0 positive answers, this is great. I'm glad you're really making some very intelligent decisions. Let's see if you can continue to do that as you get older, versus changing it up a little bit. And again, it's going to be individually patient dependent, but changing it a little bit to make commentary based on what their answers are. And then if necessary, have the means to be able to refer kids for further evaluation and treatment. That whole thing honestly takes about a minute and a half. Just to be able to do that intervention. And I think that's probably one big intervention that can save more lives more than anything else over teenagers. So we are strongly encouraging pediatricians everywhere and family practice docs and anybody else who is seeing teenagers to adopt using those screens in the office. Thank you. Yes?
Yeah, I just want to say, it's next year, my son's 26, and I found by the time he was 24, he became so centered, so peaceful.
His judgment center caught up.
I was just stunned. I've been waiting. Everything seems to come together.
It really truly is amazing that it's 25. Just up until then, it's kind of chaos. I mean, the way that the brain is just growing and different parts are growing at different times, it really is chaotic to be a young person today. But then around, as you said, the 25, 26 range, you're essentially done, and everything is hopefully a souffle that's risen instead of something that's fallen a little bit more flat. Yes?
Can you talk a little bit about video game addictions? We're hearing from parents about video game addictions, and they may go hand in hand with substance dependence, but a lot of parents express a concern about
It's
that.
all that dopamine pathway. And video addiction is actually more like gambling addiction, which are still going to fall into addiction, but it's an intermittent reward addiction. So you'll win, and you keep playing because you might actually be the winner versus not winning. And so that's what we see sort of with gambling as well. A lot of people are equally as up in arms about online gambling sites, which are easy enough for teenagers to be able to access as well. Are you 18? Yes, no. Or 21? Yes, no. Just being able to access that, there's not really much policing of gambling that goes on those sorts of online communities, and gaming is no different. The question is, with the visual stimulation of gaming, incorporated into the development of the visual cortex of the brain in the back, does that, with it linked up to the reward pathway, it's a somewhat different type of feeling, but ends up with the same end result. But the intermittent reward system, they have shown time and time again that actually keeps people coming back for more, because you're just not sure if you're going to be able to win. You're not sure if you're going to be able to get it, and that actually is something that really, really strengthens the reward pathway.
And so what are the interventions for that?
Something that nobody likes, but putting restrictions on video game time. What's interesting is, just getting back to video games, it's not even just the mental stuff, but the number of kids that I have that come in that their thumbs hurt, their wrists are sore, and I ask them, how much are you texting? 500 texts a day. I don't even, how do they have time to send 500 or 1,000 texts a day? But that repetitive, so you get sort of repetitive movement injury for the lower body, in addition to potentially decreased vision with fixation on a screen that's a fixed distance away from you. You're not using different focal points in the environment to be able to strengthen and train your eyes if you're sitting there staring at a screen constantly. So there's other effects as well besides developing addiction pathways.
I have a question about sweets.
I couldn't hear you?
Question about sweets.
Sweets, I'll try. Not as much things that I've looked at, but I could try. What's the question?
I have my daughter, she eats an innocuous amount of sweets.
Innocuous, innocent, or innocuous, like enormously huge?
Enormously. Well, in my opinion.
Okay. It does stimulate the reward pathway. As I said, food is huge, especially enjoyable food like chocolate, sweets are going to cause those dopamine surges. But again, she's going to be at risk for other physical health-related issues, such as with issues such as issues like with weight gain, with sluggishness, because when you process sugar, your body actually digests simple sugars extremely quickly. They get into your bloodstream quickly and then out. So you get that rush, not only just a dopamine rush, but that sugar high rush that then fades away because your liver digests it incredibly quickly compared to more complex molecules like proteins. Sugar is a pretty simple molecule and it can come and go very rapidly. So you end up feeling a lot of energy and then you're really tired because you don't have anything holding you through. And in addition, just the risks of not type 1 juvenile diabetes, which is where your pancreas stops working, but because the sugars actually cause your pancreas to start making more and more insulin to be able to process those sugars, can lead to type 2 diabetes. So too much sweets, equally not as good for several reasons, not just on the brain like video games, but for other impacts that can be on the child's health as well.
If they don't get enough sleep, they're gonna go to something else.
I don't. Are you saying if you deny, I'm asking just not to put words in your mouth, but are you saying if you deny your child sweets, is she going to turn to marijuana or alcohol?
Well, in a way, I wouldn't do that, but.
No, but I mean,
See, if she didn't have those sweets, then she's going to go to marijuana, alcohol, get that same, whatever that sweet does for her.
I can't make that prediction. When
It's a possibility.
it's a possibility, but there's a possibility that she might have decided to experiment with those kinds of things anyway. I mean, again, because of the way that the dopamine pathways work, you can't predict what someone's going to choose to want to satisfy those.
Get her a little trampoline. Like a little exercise trampoline. And as you slowly say no to, she's gonna get all crazy, because where's her emotions gonna go? So she can go jump on the trampoline. There.
Thanks for the suggestion. I saw a couple more in the middle. Yes.
I guess that, it's kind of a big-ish question, but, this holiday experiment is a lot lately, and I've thought about it for years. Like, this whole screen culture, like, how is it affecting the way that this skills our children need to, have conversations and to feel deeply and think deeply? It's also instant and reactive and, so enmeshed in their realm,
We are really becoming a very big instant gratification culture. The other day, Todd and I were talking at home about something, and we were trying to figure out who the actor was in some movie, and he whipped out his phone, and we figured it out. Boom, instant gratification versus having to go to the library and find microfiche and do all the other things that previously you would have needed to do. The question is, does this foster sort of an attention deficit issue and problem? And studies that they've done on kids before the age of 2 showed that increased screen time in kids in those young age groups actually did increase the risk of developing attention deficit disorder. Part of it is that when you're watching things on screen, none of it's in real time. All of it is little snippets of time that change very, very rapidly. And if your brain, again, is growing and developing, thinking that these rapid changes are normal, it becomes hard to sit and process something that's a longer one-on-one conversation. The only show that was ever formed in real time was Mr. Rogers, which isn't even on anymore. Every other show that exists has little quick movements of snippets to snippets to snippets, and it has been shown in younger kids that does contribute to development of ADD. So, who knows? Who knows sort of where we're going as a culture? The running joke is I've gotten siblings in the office, and they're sitting there madly texting on their cell phones, and I say, who are you texting? And they point to each other. This actually happens. It's not just an urban legend of things that occur, that kids seem to preferentially want to text versus having an actual conversation. And are we losing the art of communicating with one another and having kids learn how to appropriately be able to do that? We'll have to see. Are we going to eventually end up isolated in our own little cells and all we do is just send out electronic communications all day long? That would be a pretty sad state. Somebody, you in the middle.
How does prolonged gaming on computer affect brain development?
I did. I again haven't looked at the details of the gaming research. I'm not actually a full-on neuroscientist. I'm a MD pediatrician adolescent medicine specialist. It was something that I thought was really interesting, and so I started pursuing the topics and looking at other people's research. So I haven't read as much of the gaming literature, partially because I think a lot of it is in process. This is all things that are coming out now. But again, what happens, especially, I think part of what happens too is because you can game online, right? You can play a video game with someone in China. So you talk about not even connecting with people in the same room with you by playing a game. You're connecting with people around the world. And is this leading actually to increased isolationism because of more perceived globalness? Does that make sense what I'm saying? That people are going to be more likely to isolate themselves as a result of that because they perceive that they're being more global when in actuality they're isolating themselves more. But certainly sitting down and gaming for hours and hours and hours on end, this has been in the news of there was a young man in, I think, Singapore who was gaming for like 27 hours straight or just something ridiculous, who ended up needing to be hospitalized because of that. And it does have effects. We're just, because gaming is something that's relatively recent, we certainly don't have any data for how people are going to be functioning and performing when they're older adults. And is this going to contribute to any other future memory concerns or problems? We just don't know yet because we haven't gotten there longitudinally. In the back in the corner there. Alone together?
Yeah, and it's all about exactly that, how, people go on car trips now with family vacations, and that used to be time where people would talk to one another, and now everybody's in on their own device, so they're all together, and they interviewed a boy that's, kid who was 16, and asked him if he's ever interested in learning how to have a conversation, and he said that maybe one day he would be versus texting. He said maybe one day he would be, but for now he's happy. And one of the reasons that he's reluctant to have a conversation is that it was in real time and he couldn't control what he was going to say during a conversation, and he might reveal too much of himself as opposed to when it text or other things. So he could control what he was going to say and all of that, and that seems so incredibly sad. So that book is kind of encouraging.
That sounds interesting. Which was it on Fresh Air or?
It was on Diane Reed, but it wasn't Diane Reed's ship.
Okay. I will look into that then and look into the book specifically. But I think that part of the reason, perhaps, just getting back to the texting and Facebooking and everything else and not having real-time conversations is exactly what you were just alluding to. You can edit that stuff. And because part of what teens are doing is forming their own identity, and they care very much what their peers think of them, and they care very much what other people are saying about them, and if they fit into the cliques properly, you can go on Facebook, decide that you don't like what you've typed, and immediately change it. Same with a text. You can look at it before you send it and decide if this is something that you want to send or not, or do you want to change your message slightly. Once the words are out, you're right, you can't edit them. It's harder to control a conversation, even though, frankly, I think that people misconstrue things that are said in emails and texts much more often than they would if you had the subtle nuances of eye contact and vocal inflection and everything else that you get with an actual conversation. Yes, in the middle.
Yeah, I have one of each. Any significant difference between males and females in some of these studies with the THC and alcohol response?
Believe it or not, no. The short answer is that if you look at what kids choose as their dopamine pathway stimulators, more girls seem inclined toward alcohol and more boys seem inclined toward smoking marijuana. But there aren't really any large differences based on gender with the reward pathway development. Yes?
Yeah, I was wondering, do you know what are the risks in terms of teens using cell phones for brain development?
Ooh. Meaning with what's emitted by the phones and what have you. That data, again, not unlike the schizophrenia and marijuana data, is all over the place. There have been studies that have linked cell phone usage to brain tumor development, and then other studies that show that there were no difference. For that in particular, you can find a study basically to agree with any opinion that you might have with cell phone use. For a while, everybody was much more enthusiastic about hands-free. I do think that phones today probably are emitting a whole lot less energy than phones previously. Is it better, worse, or the same? I don't know. And again, that's not something that I've looked at particularly in detail, so it remains to be seen.
Yeah, I just for 2 years we're hearing on NPR that in Scandinavia they weren't allowing children, it's illegal for a child to have a cell phone.
And I remember hearing about that as well. It was under the age of 12, I think, that they weren't permitted to use cell phones. I'm not sure what direction that's headed in since that time, though. All right, one last.
You've probably heard since you've been here for a day or whatever that I think what the vineyard, the culture on the vineyard is much more accepting of marijuana use than a lot of other communities. Sort of goes along with, homegrown, local food. Personally, it seems to me that the most effective way to get through to kids who are using it is to do some kind of condensed version of what we presented today. But since we don't have that, any practical advice and survey and stuff?
If you want a website that actually has a condensed version of what I did today, it's at www.teen-safe.org. It's the Children's Hospital website. It has a lot of the same data that I had, also some tips for parents and some linked up videos. It's an excellent website that would definitely be a resource I think everybody should utilize. Coming from Cambridge, the culture is not all that different. We've got a lot of the same thing in terms of marijuana usage, in terms of, again, the local, it does seem to go sort of with the earthy, crunchy local movement, which is interesting. From working in Cambridge, I've observed some similar things. So I do kind of recognize where you're coming from with that. I got to spend some time today with the kids at school. I think they were attentive and somewhat appreciative. I do think that some things did get through that we were talking about, or I hope that they did. So we did spend some time there. So if you have kids that attend the school, this might be the perfect jumping off point actually to be able to go home and talk to them about the assembly that they had versus what you've experienced here this evening and be able to create a conversation. One thing that I think is important really is creating conversations and discussing things before they happen. Parents who talk to their kids before there are any issues and all during their teen years are actually, again, significantly less, probably half as likely to have kids who end up having substantial alcohol and drug problems compared to parents who do not have any of these conversations with their kids at all. Some tips of ways of being able to go home is just as I was just saying, hey, I went to this really interesting assembly at school tonight and I learned about effects of alcohol and drugs on your brain. Did you have that during the day today? What did you think of the program? So starting off something like that. One of my very favorite questions to ask in the office is, do you know anyone who? Do you know anyone who smokes? Do you know anyone who drinks? Do you know anyone who has had sex? Do you know anyone who uses drugs? That's especially effective with younger kids. By the time kids are 12 or 13, they all know somebody and have a peer who uses those things. And then you can sort of continue the conversation of, how about any of your friends or any close friends versus acquaintances and kids at school? What would you do if you were somewhere and somebody offered you to smoke marijuana? And creating these scenarios in advance is just incredibly helpful and can arm them with tools and frankly lets them know that you care and that it is something that is important to you as a parent to help keep them healthy and safe. All right, everyone, thanks for your attention.